Hi, Andre. How are you?
Hello, I'm doing well, thank you. How are you?
I'm doing great as well. We will start at 9:05, 8:05,
Okay.
according to our Bangladesh time. So, and today the host will be Mukta Bormon and Sumay Bashar Dola. So they both will be coordinating with you during the session. Okay.
Okay. Great. Thank you.
Okay. You may check your slides if they are working well or not. So no technical issues occur during this session.
Okay.
Okay.
Good evening, everyone. Am I audible?
Yes.
Yes, ma'am.
Okay,
Yes, you are.
thank you. Good evening. I warmly welcome you all to today's international session under the International Free Workshop 2026 series. I am 𝐬𝐫𝐻𝐵𝐻𝐚, Assistant Academic Lead at Bangladesh Institute of Innovative Health Research, BIIHR, and it is truly an honor to host this important session today. Thank you for joining us from different regions and professional backgrounds. Bangladesh Institute of Innovative Health Research is a non-profit research-based organization established to promote a strong research culture, especially among undergraduate students. We focus on empowering students and professionals through research training, academic mentorship, and skill-based programs, creating a bridge between knowledge and real-world impact. Now, it is my great pleasure to introduce our esteemed facilitator for today's session, Dr. Andrea M. Barnes. Dr. Barnes is a program consultant and advisor at BIIHR. She holds a Doctor of Behavioral Health (DBH) from Arizona State University. She currently serves as adjunct faculty at Urban College of Boston, editorial fellow at the Family System and Health Journal (APA), state policy representative for the Pennsylvania Academy of Nutrition and Dietetics. With her extensive experience in clinical practice, behavioral health, academia, and policy leadership, we are truly privileged to have her guide us through today's topic on why research plays a vital role in connecting healthcare practice and policy. Before we begin, a few quick instructions for today's session. The session will run for approximately 1 to 1.5 hours. The language of instruction will be English. You may ask your questions through the chat box or orally during the designed Q&A segment. We encourage active participation to make this session interactive and impactful. So now, without further delay, I would like to invite Dr. Andrea M. Barnes to lead us through today's session. We are excited to learn from your expertise. Dr. Barnes, over to you. Thank you.
Thank you so much. Am I audible?
Yes, you are.
Okay. And can you see my shared screen?
Yes, we can.
Okay. Thank you very much. So welcome to today's session. As mentioned, I'm Dr. Andrea Barnes. And thank you for having me. Today, we explore a persistent challenge in global healthcare: why strong clinical evidence so often fails to shape policy or transform systems. As clinicians, researchers, educators, and advocates, we occupy critical positions within the healthcare ecosystem. And this session is about understanding how research serves as the connective tissue between individual patient care and large-scale policy reform. We will move through theory to application and from systems analysis to practical engagement strategies. And because this is an international audience, we bring diverse systems, regulatory environments, and cultural contexts into this virtual room. And I encourage respectful exchange and critical reflection. Our goal is not consensus today, but understanding. And I will incorporate some brief reflective activities and invite discussion at the end of the presentation, particularly around implementation barriers within your own contexts. So please approach this as a collaborative learning environment. The research practice policy gap refers to the delay and distortion that occur as knowledge moves from scientific publication to bedside care and eventually on to legislation. And on average, it can take over a decade for strong evidence to be adopted widely in our clinical settings. And even then, policy alignment is not guaranteed. This gap is rarely about lack of knowledge. It is about infrastructure incentives, reimbursement structures, workforce training, and political will. In many low and middle income settings, additional constraints include resource scarcity and limited research dissemination networks. Now, evidence alone is insufficient. Research may demonstrate efficacy under controlled conditions, yet real-world environments introduce complexity. Policymakers often prioritize budget impact, feasibility, and the perception of the public. And when researchers do not frame findings in terms of economic implications or health equity outcomes, evidence loses traction. Effective translation requires that interdisciplinary dialogue and implementation planning start from the outset. So let's consider behavioral health integration. Here's some real-world examples from behavioral health and nutrition policy, which are my areas of expertise. And evidence supports collaborative care models that improve outcomes for depression and anxiety, yet reimbursement policies often lag behind integrated models. In nutrition policy, food insecurity screening has demonstrated associations with improved referral pathways, but reimbursement and infrastructure vary significantly by region. And so these examples demonstrate how strong evidence does not automatically shift systems. Evidence-based practice requires synthesis of research findings, clinical expertise, and of course, patient preference. It is not rigid protocol adherence. High quality research includes strong methodology, reproducibility, and applicability to diverse populations. Now, clinicians serve as translators, adapting their findings to individual circumstances while maintaining fidelity to core evidence. Patient-centered translation requires attention to culture, socioeconomic context, and structural barriers. Research must inform care pathways, but clinicians must adapt to realities such as language access, stigma, and social determinants of health. Interdisciplinary collaboration enhances this translation process by bringing multiple lenses to a shared care plan. Now, I have a case illustration here, and this case centers on the collaborative care model for depression management within the primary care setting. Depression is among the most prevalent behavioral health condition globally, and primary care settings often serve as the first and sometimes only point of contact for our patients. However, traditional referral-based models frequently fail due to stigma, long wait times, and fragmented systems. High-quality, randomized controlled trials have consistently shown that embedding behavioral health care managers within primary care teams improves symptom reduction and treatment adherence. Standardized measurement tools such as the PHQ-9 allow for systematic monitoring and adjustment of care plans. Now, meta-analyses further demonstrate that collaborative care is cost-effective over time, particularly when examining reductions in emergency department visits and hospitalizations. But despite this robust evidence base, widespread implementation has been very uneven. A central barrier is reimbursement. Fee-for-service systems do not adequately compensate team-based behavioral health management. In response, policy shifts introduced collaborative care billing codes in certain countries, including Medicare codes that reimburse care coordination activities. However, uptake remains variable due to documentation burden and lack of training. Workforce capacity also limits the scale. Many regions face shortages of licensed behavioral health professionals. Implementation requires training primary care teams in measurement-based care, stepped care algorithms, and definitely interdisciplinary communication. Now, this example demonstrates the critical bridge between research and policy. Evidence alone establishes efficacy. Policy reform was required, though, to enable reimbursement. And workforce development initiatives were necessary to sustain implementation. An ongoing evaluation ensures that outcomes align with population health goals. Now, we are going to see some contrast across settings. In high-income systems with value-based payment models, collaborative care aligns with quality metrics and population health targets. In low and middle income contexts, task shifting approaches may substitute specialist-led models, training community health workers to deliver evidence-informed behavioral interventions under supervision. This global perspective reinforces that translation requires contextual adaptation without abandoning core evidence. If this model works in controlled trials, what specific structural barrier in your country or health system would most likely delay implementation? I'll let you think on that for a moment. Health policy is shaped by data, but also by narrative. Systematic reviews and meta-analyses strengthen credibility. Professional organizations amplify findings through position statements, and clinicians and researchers can submit testimony, serve on advisory committees, and collaborate with advocacy groups to elevate evidence in legislative arenas. Researchers and clinicians can intervene at multiple stages. During the agenda setting process, epidemiological data can define urgency. During formulation, cost analyses guide the feasibility discussions. And during the evaluation process, outcome metrics can determine continuation or revision of programs. So understanding this cycle allows strategic engagement rather than reactive advocacy. So now it's your turn. I'd like you to take 5 minutes to reflect on a health issue relevant to your context. Consider whether high quality evidence exists and what structural barriers prevent implementation. You can identify at least one stakeholder group essential to moving evidence into policy. And if you'd like, you can just share it in the chat. So is there a pressing health issue in your region? And if so, what evidence exists? And what barriers prevent adoption of policy? I see engaging in good advocacy negotiation. Yep. What stakeholders must be engaged in that advocacy negotiation? So implementation science examines how to move from publication to sustained practice. Frameworks like the RE-AIM evaluate reach, effectiveness, adoption, implementation, and maintenance. Systems thinking emphasizes interdependencies across financing, workforce, governance, and community engagement. And without systems alignment, innovation remains isolated. Measurement of your impact and outcomes determines credibility. Policymakers require quantifiable outcomes, cost implications, and the population level impact. Things like equity metrics are critical to ensure that implementation does not widen disparities. Sustainable impact requires continuous evaluation beyond initial pilot phases. Now you can build a research-informed career path. Career pathways are very diverse. Clinicians can pursue research coordination, contribute to academic publishing, or engage through professional organizations. Policy engagement may include serving as state representatives or participating in international health initiatives. Now, the key is cultivating methodological literacy and systems awareness. For early career professionals, you should prioritize those methodological competencies and communication skills. Publishing is valuable, but so is translating the evidence for non-academic audiences, right? When we publish, we only really reach that one academic audience, and it may never get past those eyes and ears. How do we translate that into a program, or implement that in our regions? So seek opportunities to present findings in places such as policy forums and other community settings. Leadership in professional organizations actually provides practical exposure to policy processes. And that's actually where I got my start in the Academy of Nutrition and Dietetics at the local affiliate level, and then moving up to the state affiliate level here in the United States. I began working with our public policy team, met with legislators. They taught me how to evaluate policy, how to tell stories to our legislators, and even just how to approach legislators, because that can be very intimidating no matter what country you're in. Now, today we have examined why research matters beyond publication, the structural barriers that limit evidence adoption, strategies for engaging policymakers, and discussed pathways toward research-informed leadership, ones that allow clinicians to operate beyond that direct patient care. So I encourage you to view yourselves not only as clinicians or researchers, but as systems actors capable of influencing structural change. So as we transition into some open discussion, I would like to move us from reflection to activation. And so the goal of this session is not simply to understand the research practice policy gap, but to begin narrowing it within your own professional context. So I'm going to have you go back to, first identifying that one issue in your setting where strong evidence exists, but implementation is inconsistent. Now, this might involve behavioral health integration, nutrition policy, chronic disease management, or access to preventive care. So what is one research-informed issue in your setting that requires policy attention? And then second, examine the structural barrier. Is the limitation financial? Is it regulatory? Is it workforce related or political? I'm seeing some things in the chat. There's limited local vaccines for infectious diseases. I'm I'm seeing limited focus on research areas, specifically advanced biotechnology. I'm seeing shortage of trained professionals. So what structural barrier limits implementation, and who controls the levers of change? I'm seeing in the chat limited awareness among parents and caregivers, high dependence on digital devices for child management, resource constraints for monitoring and implementation. I'm seeing stakeholders to engage would be the Ministry of Health and Family Welfare, Ministry of Education, parents and caregivers, early childhood development centers and schools, definitely, NGOs, yep. So understanding the nature of the barrier determines the type of engagement that's going to be required. Bangladesh Institute of Innovative Research, Health Research, yep. Local leaders and budget, yep. Now, once you've identified what those structural barriers are and who controls the levers of change, now you want to map those stakeholders. Who has decision-making authority? Who influences funding streams? Who shapes those professional standards? Effective policy translation requires alignment among clinicians, researchers, administrators, and legislators. So we need to engage all of those. We need to know, again, who has the ability to make decisions, who is going to support the funding, and who is dictating what the standards of care are, what our scope of practice is as clinicians. And then fourth, assess the evidence. Is the evidence sufficiently localized? Policymakers often respond more strongly to region-specific data. So here in the United States, the way our government is broken down at the states level, we have districts. And so a representative or a senator is more likely to respond to an issue that is representative of the constituents in their district. And they're going to want to see specific data on how, if they support what you are bringing to them, how is it going to impact the people in their specific district or community? Zahad says, in my community, there's a huge amount of people with low social capital, and they face limited access in healthcare services and foods. That's absolutely true, not in just your community. And then finally, I encourage each of you to articulate one short-term action within 30 days. So when I say short-term, that is 30 days or a month. This might include drafting a brief policy summary. So taking your research and then, drafting a policy summary from that. Initiating a meeting with a professional organization. So As a registered dietitian, I might reach out to the Academy of Nutrition and Dietetics. As a doctor of behavioral health, I might reach out to the American Psychological Association, or another professional organization in another country, the Bangladesh Institute for Innovative Health Research, perhaps. You can also go as far as reviewing reimbursement policies in your region. Now, I know, health services are limited, across the world, and insurance is an even bigger problem. But if there are reimbursement policies or lack thereof in your region, understanding them and then kind of combining your policy summary, your information that you received from that professional organization, and then those reimbursement policies or lack thereof can really strengthen your case as you approach a government. And then consider a longer term system goal that may require something like coalition building or institutional change. Now, the purpose of this discussion is to help you leave not only informed, but positioned for strategic engagement. So I'd like to open it up for discussion and questions. Policy conversations rarely hinge on clinical outcomes alone. Economic framing, workforce sustainability, and health equity arguments often determine that legislative traction. And when we're engaging with policymakers, clarity and brevity are essential, right? Our policymakers don't have time to speak with us. They may have 15 to 30 minutes. So, you need to speak clearly, you need to be concise, and then translating your research into 2 to 3 key impact statements can be more influential than, presenting your entire study. Politicians are not going to have time to read your entire manuscript. So, you really need to come up with 3 key statements, or, what is your ask? What do you need from them? And then, reiterate that ask at the end of your meeting. So, to our hosts, I'd like to open it up for discussion, specifically on these questions for reflection. What language really resonates with policymakers in your region? What economic or equity argument could really strengthen your case? And what implementation data would increase the credibility of your research? And lastly, how can interdisciplinary collaboration accelerate change? So I'm seeing in the chat I can't see any other option than collaboration, association with already established organizations for short-term action. I've observed huge amount of discrimination in healthcare settings towards marginalized communities. Yes, we're seeing that everywhere, not just in low to middle income countries. We're seeing that very much in high income areas as well. Would anybody like to come off mute and share some reflections with us? There's a critical gap between clinical nutrition evidence and the commercial food environment. Absolutely. We're seeing a lot of nutrition evidence come out as to what is a healthy diet, but does not translate to what is available or accessible in different communities. And policy must incentivize the development and regulation of scientifically validated functional foods that support preventive health. Yes, we need to make all of those foods available if we expect consumers to be able to use them for their preventative health. We're seeing a lot of food deserts where there might be one bodega where only ultra processed foods, which I realize is a term that is up for discussion as to what that is really defined as. But in those bodegas, maybe only processed foods are available. There are no fresh fruits and vegetables in those areas, or maybe there is a lack of transportation to getting to where those fresh fruits and vegetables are available. Here in the United States, we have government programs that make fresh fruits and vegetables available to like the elderly population through farmers markets. However, there isn't transportation for these individuals to get to the farmers markets. I'm seeing in the chat, is this work directly related to the medical, forensic, legal, or policy making field? I'm not sure what you mean by this work. If you're speaking about research, yes. Nutrition. Okay, yes, research. Yes, research is directly related to everything we do in the medical field and all of its arms, whether that is, preventive medicine, nutrition, behavioral health, forensics. And yes, we need to not only do the research, but the whole point of this presentation is to, take that research and translate it in a way that policymakers can understand why it is important to then implement. So we need to see that data that would increase the credibility of our research. And then oftentimes, we're seeing lots of pilot studies, but they're just too small. We need to see the these pilot studies expanded so that we can see how they really impact the communities at large. Other questions? For those who are working in legal or forensic fields, do you think it is important for them to study this area? I would say yes. I am not in a legal field or forensic field, but I would say that it is important to have evidence-based research to support those legal and forensic fields and the work that you're doing in them. You know, you're not going to be able to change anybody's mind in the legal stance without facts to support what you're trying to accomplish. What do you think about interdisciplinary collaboration accelerating changes? How have you seen this work in your communities? You're very welcome. Absolutely, 𝐬𝐞𝐬𝐞𝐚𝐫𝐜𝐻.
Hello, this is Khalid Mahmood, and I'm PhD English Linguistics Scholar at University of Management.
Yes, welcome.
First of all, congratulations, Dr. Andrea, for your wonderful presentation. And you have opened up discussion on the policy matters, on the nutrition.
Oh, you're breaking up a little,
difference of
Khalid.
climate. Yes. And so
Yes,
due to the different weather conditions, we have different food cultures, but over a period of time, the wave of McDonaldization and globalization has also affected this region. And this region is very uh, popular in loving the fast foods. And so due to this habits, the health condition of the people in this region is deteriorating by day and day. And there is no specific healthcare facilities available to cater for this very specific need. So there should be policy that on the basis of the regions and on the basis of the climate and the weather, the food should be consumed according to the weather conditions and the habits of the generations, so that we should not face these type of health issues in future.
Yes, thank you for sharing that, Khalid. And I absolutely agree. We're seeing that climate change is changing our growing practices of what our regions are able to produce. And in some cases, you know, changing the nutrient content of the you know, fruits and vegetables or other things that we grow. And I, you know, 100% agree when it comes to, and I liked your term, the McDonaldization of society, which which is actually a book. I recommend you read it. It's not my book, but I have read it, and it's a great book. You know, we're seeing that, you know, fast food can be inexpensive. It can fill bellies. It can be comforting. And it satisfies all of the need for taste, right? Sweet, salty, fat. But, you know, on the other hand, it adds to our economics, right? So when these fast food chains are popping up on, you know, street corners everywhere, people can access them and they can, you know, buy those foods regularly. And so that adds to our economic framework. And so there we are really seeing, you know, an issue prioritizing, you know, the health of our communities over the economics of our communities. Emily says, oftentimes when working with an invisible population, it is very hard to collect data even after collaborating with different CBOs, NGOs. How do you think we can navigate that? That is a really great question, because, you know, a lot of our data collection can be done digitally, but not everyone has access to the internet. You know, there's lots of things that can affect your data collection. So lack of access, stigma, you know, language barriers. So those are things that need to be worked out. Those barriers need to be worked out in the methodology of your research. And then, you know, you can expand on that. And that's why some pilot studies often have such small populations. And then, you know, they try to get a sample that is representative of the larger population. But, you know, really, once you have the data for that smaller population, then you need to be able to apply it to see how it really impacts that larger population. Yes, any kind of policy reform recommendations would need valid data backing them up. Yeah, I think, you know, definitely the data strengthens your case. But I also think when talking to policymakers, storytelling can be very influential. Specifically, if you know the history of the specific policymaker. Perhaps the policymaker has been affected by cancer in their immediate family. And so when you are thinking about what stories to share that add to the credibility of your case, you may want to share something that sort of hits home for that person. You know, make them reflect on their own history, their own family. And so sometimes when you don't have the, you know, a large sample population of data collection, those intimate stories can really help sort of back things up for you. Aparna says, I think research on genomic medicine would help reduce genetic disease and side effects of unsuitable medication as well. Yes, genomic medicine, genomic research is a huge field, one that I do not have expertise in, but definitely I believe that it would help reduce, you know, hereditary disease. For lower setting populations with water, air pollution, and health, how the hyperscale data centers work on the data and tools to study the potential impacts of the following pollutions causing adverse outcomes. How does the hyperscale data centers work on the data and tools? I don't actually know how to answer this question, Anima, but I can look into it for you and get back on that. I am sure, you know, air pollution and water pollution are definitely affecting the health of our populations and causing adverse health outcomes. But I don't know that I can answer about hyperscale data centers and how they work on the data and tools. Zahad is a student of sociology field, and his research interest in public health. Sometimes he feels it's difficult to do clinical research or epidemiology research, but when he thinks deeply about the health issues affecting his community, he finds a lot of problems related to social behavior effect on health. And so he's going to do research in this field. So I think to get started in a field or a field of research where you're not, you know, an expert in, it's definitely my number one recommendation to get involved in organizations, professional organizations that might be doing that research. You know, like the Bangladesh Institute of Innovative Health Research, or other professional organizations where you might be able to volunteer at a lower level. A lot of professional organizations really encourage students to get involved, and that can really open your, you know, opportunities to get involved at a lower level. And then once you feel more comfortable, you can expand in your role, especially as you are, you know, learning and earning your degree. Another recommendation would be to find a mentor. You know, there are a lot of people on our social media channels, such as LinkedIn, that could help, you know, expand your vision into some of these areas, and, you know, point you in the direction of where you can get, you know, started. Those would be my, you know, two top recommendations. Next would be, you know, within your studies, perhaps there are advisors or research faculty that might be looking for help on a research study that you're interested in. There might be lower level opportunities there where you can, even just observe and help those individuals out. And, as they expand on their own research, there might be additional opportunities for you to get involved. So those would be the 3 suggestions I have for those, who are trying to get into the research in a particular field. In response to your question about how to keep your mind calm and do best in this field, I would definitely consider some sort of mindfulness practice, and reach out to those people who are experts in the field, who can guide you on best practices in those fields. Other questions or open discussion? You're very welcome, Zihad.
Oh, can I say something? Like, I don't have a question, but I would like to discuss what Zihad said.
Yes,
So,
absolutely.
Ziad is from sociology, and I got a lot of friends from computer science and like AAA. And as a life science student, I think if someone with a non-life science background wants to get into the research, he should first try to narrow it down in which field he wants to get focused, because life science has a lot of fields. Like, you cannot count the sub branches. Like, for example, computational vaccine designing, from genomics to genetics to medicine, nutrition, a lot. So first thing is you should narrow it down. Then you should find some of the real uh, academic students uh, who does not hold any certificates, but at least they're trying to get on that, or they're in an undergraduate, or maybe working in a research. Try them, talking with them, and then uh, seek for voluntary things, like, for example, working with an organization, as you have said, or maybe finding some university faculties, etc., etc. But the very first thing is to narrow it down, because life science is not a single thing. And I would like to add this. Thank you.
Yes, I would agree. Although I would say that sometimes you may not know how you can narrow that down if you're not exposed to all these different opportunities. So I would say that, if you could think about what is affecting your community the most, maybe start there, or just, observe some of the meetings that professional organizations are having, and see what is available. Maybe something will spark your interest. The next question is, I am a student of the public health department and I am interested in research. Which public health field topics are currently in high demand? I would say that there are a lot of opportunities there. I would say right now, in my opinion, the highest demand clusters around health equity, mental health, climate resilience, technology, and food systems. These areas, I think, are showing up consistently across leading organizations and academic hubs, and they reflect the most urgent population level challenges. In Bangladesh, we're facing a silent killer because most people have no idea that popular street foods are packed with toxic trans fats. Although the government passed a 2% limit law in 2021, a lack of enforcement means that 92% of sampled oils in Dhaka are still dangerously high in trans fats, causing over 5,700 deaths annually. This is a massive equity issue. Yeah, I would agree. I don't know the specific statistics and can't corroborate the statistics that you're sharing. However, I would say that, this comes down to, again, an availability issue, that, there's street foods available where there's going to be demand. And if there's demand, there's economic development. And so, the government may only be able to pass a 2% limit. So this is definitely something that needs to be, further researched and presented to policymakers to show, how can we keep our economics high if we reduce, fast foods, street foods? How can we make street foods healthier, but still keep them tasty and in demand? So these are things that need to be presented to policymakers. Let's see. Another individual asks, my background is food and nutrition. Wonderful. I'm searching for an interesting research topic, but still didn't find one. So yeah, my recommendation would again be think about what is impacting those closest to you, whether it's family or community, and start there. What might have the biggest impact for you? Or you could see, look at the statistics of, what are the biggest areas that are affecting your community, such as the information that was just shared about Dhaka. As a first-year undergraduate student, what can be a good start for initiating research and finding good opportunities? Yeah, so I think, we may have covered this topic a little bit. Find someone that is already doing research that interests you and see where you can help out. If you want to initiate your own research, start with something like a systematic review. Review research and literature that, is already discussing a topic that is interesting to you, and then see where the gaps are. If you can identify the gaps in other people's research, that will be a great place for you to start building and expanding on that topic. I'm a first-year undergraduate student. My major is English, International Communication and Technology. I'm very interested in doing research in my field. I want to develop my knowledge and skills through legal research. I would be grateful for your guidance on how I can start. Yeah, again, legal is not really my expertise, but again, I think if you find a person who is already doing research in an area, find out how you can get involved, or as I said, start with a review paper and see where the gaps are. And in doing those kinds of literature searches will also help you develop your own knowledge of the topic. And then for developing skills, getting involved in research groups in the academic setting or in professional organizations would really be a way to help you build your skills. Anyone else? Do we have additional questions? I'm a student from anthropology department for starting research on public health. What instructions or way should I follow for doing better in that field? Again, there are experts out there that you can find through social channels such as LinkedIn or other professional organizations that combined studies from anthropology with public health. And so, I think, doing your own research on, where those experts exist, reaching out to them, finding out how you can get involved. I know that can be somewhat intimidating, but, the worst that they can say is no, right? And so you find someone else. And see where you can get involved. Enema has a question that she'd like to share.
Yes, Professor.
Yes.
Professor, I had a question regarding the elderly with NCDs, like the non-communicable diseases.
Yes.
The people within the rural lower area settings with a lower socioeconomic status. In like a similar situation in my country, I wanted to know that for people like the elderly people with NCDs, and how should be the emergency response and the strategical approach for the public health medicine and providing the emergency response. What do you think that how should be the policy settings and the advocacy negotiations? I want to know in case for the people with elderly with NCDs and the emergency response specifically, and also I would like to know that how these strategies are implemented in the US so that we can try to improve or we can try to implement in those lower resource settings.
Yes. Thank you for your question. So what I would say is, number one, research and understand what the current emergency response is. And then once you can identify where the gaps are, Then you can figure out, an area where there needs to be improvement. And then you can either do, additional research to see, has, someone looked into this area for improvement before? If not, that would be where you can, do a pilot study. Maybe try to reach out to those emergency response providers and see if they would be, willing to hear you out about the area of improvement, and if they would allow you to, participate in doing a small pilot study. And then you could take that data and bring it to, policymakers. Again, when you're engaging with policymakers, sharing stories about how the elderly community is impacted, or, a lack thereof of emergency response. That's how you get the conversation started. And then, I'm not sure what you call it in other countries specifically, but in the United States, we call it grassroots advocacy, which means, advocacy from the ground up. So, we want to get, as many people involved in advocating as possible. And, through our professional organizations, I'll speak specifically to our nutrition organization. We gather, individuals who have a passion for improving in a specific area. And then, we provide talking points, we provide information to leave behind, whether that's a white paper or, some kind of informational study. And we help individuals figure out who their legislators are and help set up meetings for them. Sometimes we gather as a group. If you have the availability and accessibility to do virtual meetings with your policymakers, you can get a lot more people involved that way. You don't have to worry about transportation necessarily. But the more people that are involved in the advocacy effort, the more the voice is strengthened. So that's how I would approach specifically, improving emergency response in, elderly non-communicable disease. Well, I want to thank everyone for joining this session today. Thank you for your questions. I am happy to answer additional questions through email. You can please reach out to me. I would love to engage in further discussion. And I believe this session is being recorded and will be available for you to review at a later time and reflect on. And I hope that it gave you a chance to reflect on what's going on in your own communities and how you can really bridge those gaps between research and practice and policy. So thank you very much. Very happy to be here today.
We are at the end of our session today. Thank you, Dr. Barnes, for such an insightful and inspiring session. And thank you all. Thank you to all our participants for your active engagement today. If any of you have any queries or opinion, please drop it in the comment box or let us know through email. And on behalf of BIIHR, we truly appreciate your presence and look forward to welcoming you to our upcoming sessions. And have a wonderful evening, everyone. Thank you.
Thank you as well.
Thank you.
Thank you, ma'am, for this wonderful session.
You are very welcome.
Thank you very much, Doctor, for your time and all the things. I really appreciate, and it was very inspiring.
You're very welcome. Thank you for joining us today.